Okay, let's prompt you right here. Alright, so let's see. Today, since I don't do it often, I am going to talk about plastic surgery. Okay, I'm almost 2 months out. I had my plastic surgery on January 15th of 2010. That was actually a year out of me having lap band surgery. I had lap band surgery on January 6, 2009. By August 15, 2009, I had lost about 120 pounds. So I had lost usually all of my weight within 7 months and 3 weeks out of having lap band surgery. I started out at 275, and I worked my way down all the way to 150 pounds. Well, my goal weight was to be 160. By the time I had plastic surgery, I was 150 pounds. Between August that I had reached my goal until January of 2010, I had maintained my weight and got even lower than my goal weight. Like I told you, my goal weight was to be 160. I had went down to 150 by the time surgery came. So I did a good job in maintaining my weight, and I went ahead and I decided to do plastic surgery. For those of you who don't know, I went to Colombia in Bogota to do my plastic surgery. I'm originally from New York, and over here they wanted to charge me $10,000 just to do a tummy tuck. So the reason why I chose what exactly I chose to do was a tummy tuck. I didn't really have that much hanging skin, excess skin. I have previous videos showing exactly what I had wrong with my stomach, if you want to go back and look at my previous videos. But what I did have was a lot of kind of wrinkly skin and stretched out. I mean, it really looked horrible. The worst part of the weight loss had to be my breast. I had started out being a D cup, I believe, or a double D, and I went all the way down to a small B, ready to go into a size A. And I have to say that my breasts were completely deflated, and I think that was the worst one besides the stomach area. But anyway, what I got done in Colombia was a tummy tuck. I had gotten lipo in several areas. I had gotten lipo in, I think, my upper back, my flanks, and my inner thighs. And the reason why I had gotten lipo in so many areas, because what I had decided to do and what the doctor convinced me to do was go ahead and do a Brazilian butt lift. And what a Brazilian butt lift is a transfer of fat from the lipo that he had taken and transfer it to my butt, since I had a flat ass from all the weight that I lost. So that's what we did, and that's why lipo was taken out of so many areas. And I also did a breast lift and breast augmentation. And the reason why I did breast augmentation, which I never thought in my life that I would do breast augmentation, or rather breast implants, is because I was big chested all of my life, never had a small chest, and never thought I would do the procedure in my life. But anyway, what happens when you do a breast lift is that you get reduced by a size. So if I was a B, I was going to go ahead and be a size A after the surgery. So I said, no, go ahead and do breast implants. And I decided to get silicone, and I was at 400, and I got 400 cc's, which at the time I didn't know exactly what cup I was until recently that I went into Victoria's Secrets, because I had to wear their type of bra, or compression bra, whatever you may call it. So I am now a size D cup to double D, depending on the bra, anywhere between a D and a double D, which to me was a surprise because I thought I was a C. But anyway, they did the anchor on me, which is like this and like this, and I do have scarring from it. and I'm gonna go ahead and tell you a little bit about the plastic surgery. Okay, first of all, the girdle that they make me wear is for 3 months. Am I consistent on it? No, because it's a freaking pain in the ass. What can I say about it? It leaves you marks. When I eat, it's so tight that I have to unzipper it. If I don't unzipper it, it causes gas. And from me having lap band surgery or whatever, I get gas frequently. So it's a must that I have to go ahead and unzip it to let me breathe and not get those gas pains. The girdle is a full girdle. It comes, I'm not wearing it of course now because I'm just so tired of it. It's like a full girdle. It comes from here all the way down to your knee level. So it's like basically having shorts. Everything is just a full girdle. And sometimes it's so tight that it opens wounds. Yes, it opens wounds. The wounds that had been open were the ones from the tummy tuck, and they were the ones from the side, which has been the most difficult to deal with because it's taking more longer than what I had wanted to close. I originally thought when I had taken the tape out, the drain, which is more like a white tape, that it was going to close after 48 hours. However, it has not closed as of yet. Well, now it's getting better, and it has actually now stopped leaking, thank God, because I have been dealing with that for almost 2 months, and now I am like, thank God I am not leaking, because what I had to do was always wear pads on the side of my panties, which is not fun at all. Also, what else? If you ask me right now if I regret having plastic surgery, I don't think that it would be a good discussion to talk about, because I'm only a month and a half to 2 months out and nothing still looks right. I mean, I have complaints all the time about my tummy area. I still have this pouch, which I'm like trying to get rid of, and I've been doing ab exercises to get rid of it. I just want it to be completely flat, and sometimes I'm like stressing myself. I'm like, well, did he do a good job? I mean, isn't it supposed to be completely flat? But I know it takes time, and I'm a very impatient person, and hopefully I'll start seeing my results soon. Another thing I don't like is all the scarring area. Like I told you, I have the scars go from my stomach. I have the bikini tummy tuck, so it's like right above the vaginal area until like my hip area, and I have the anchor scar, and I have 3 small scars in the back, 2 of them in my lower back from doing the Brazilian butt lift, and 1 in the middle of my back from the lipo. The most tender part of my procedure afterwards was I guess the lipo they had taken from my upper back around the rib area. That was the most tender part. If you ask me to compare my pain, well, it's kind of funny because most people say, oh, well, you know, breast surgery or tummy tucks are very painful. To me, I mean, it's like, what pain? Seriously. I mean, compared to my other video where you saw all the blood and stuff like that, it was pretty much painless free. And I really mean that. I mean, to compare the pain from my lap band surgery, I think that I suffered more with the lap band surgery with all the gases. Now, was it all pain-free? No. I mean, I was good for about 2 weeks, and I think the 3rd week I started experiencing some pain. Again, it was with gas or whatever, but I think it had to do with the compression of the garment. And I also felt, I mean, and I've always felt the discomfort of the 2 side incisions where I had the drains that I leaked from, and I'm still leaking. Well, it stopped. But I guess the most pain I ever felt was when I actually went to the Vegas